Great, thank you very much. Good evening. I am a clinical professor, so I like to start on time, but not a minute early. My name is Alexandra Shepard, and it's my privilege to be your CDHA president. I am also a DHAA member. I, along with the CDHA board, represent over 22,000 dental hygienists nationally and around 3,700 dental hygienists in the province of Alberta. I would like to thank the CEO, Ondina Love, the CDHA board, the staff of the CDHA, colleagues, and you, dental hygienists of Alberta and in Canada too. This Zoom has a cap of 300. If we go beyond, we are recording and we will send out the link. Many of you I have taught, and you know me as Professor Shepard. Many of you I have not met formally yet. I have been a registered dental hygienist in the province of Alberta for 32 years and a CDHA member since I was a student at the University of Alberta. I'm a clinical professor at the University of Alberta for 26 years, and my areas of expertise focus on ethics and professionalism, periodontology, prescription writing, and clinical skills. I am a researcher and have presented provincially, nationally, and internationally. In addition, I maintain 1 day per week in clinical practice and have been at the same practice for 29 and a half years. I have restricted authorization to deliver local anesthesia, nitrous oxide and oxygen conscious sedation, and since 2009 have been a prescriber in the province of Alberta. I offer a prescribing study club free of charge to the students that I've taught since 2020. I was on the Commission for Dental Accreditation in Canada for 8 years, the last 3 years as chair of the Dental Hygiene Committee. I advocated and met with members of the Legislative Assembly in 2006 to advocate for changes in the dental hygienist profession regulation, which resulted in unsupervised, independent practice for dental hygienists in the province of Alberta. Since my appointment to the CDHA board in 2018, elected by you, I have participated in many lobby days as a dental hygienist to advocate for improvements to oral health care in Canada. I am passionate about dental hygiene and the dental hygiene profession. CDHA wants to work with the DHAA. We have constituent agreements with 80% of the provinces in Canada. Dental hygienists working with dental hygienists will truly advance the profession. Also, we encourage dental hygienists in Alberta to join both DHAA and the CDHA. We need strong professional associations at both the provincial and national levels. My presentation is approximately 20 minutes. Truly, it's probably going to be 25, and includes answers to questions posed to me by your DHA President, Laura Wright, and the DHA Board of Directors. At the moment, the chat is closed. Instead, I encourage you to enter your questions into the Q&A box, and I will answer these questions at the end of the presentation. Respectful dialogue is expected. Next slide, please. As we gather today for this virtual meeting, we respectfully acknowledge our coming together from various ancestral lands of Indigenous peoples across the country. We honor the treaty territories and unceded lands of Turtle Island and thank the generations of Indigenous peoples who were stewards of these lands for thousands of years, leaving their footprints long before us. From coast to coast to coast, we acknowledge the traditional, ancestral, and unceded territory of all the Inuit, Métis, and First Nations people that call this land home. We offer this land acknowledgement as an intentional and thoughtful way to remember and thank those communities upon whose land we now reside. This acknowledgement should not serve as closure, resignation, or acceptance of the past or present, but should remind us of the true history of this country and provoke thoughtful reflection, conversation, and lasting change. I would like to acknowledge that Saturday, June 21st, was National Indigenous Peoples Day. One of the CDHA's board discussions has been to include thoughtful inclusion of the Truth and Reconciliation Commission calls to action. We, both the DHAA and the CDHA, neglected to highlight this on June 21st. And I hope that on Truth and Reconciliation Day on September 30th, we will both do better. And next year on June 21st, we will both acknowledge the day on our social media platforms. CDHA and Hugh Freedy Group are in their final year of their partnership on the Indigenous Student Bursary, and I would like to give thanks to those who purchased a limited edition Hugh Freedy sickle scaler. Profits from these sales are funding this bursary over a 3-year period and provide financial assistance to our Indigenous new graduates. We still have a few left, if you would like to support this. CDHA and the Board of Directors focus on strategic areas known as ends. Less than a week ago, on Tuesday, June 17th, the CEO, Ondina Love, and the past president, Francine Trudeau, had a press release. The CEO and CDHA past president and CDHA staff spoke about the dental hygiene profession in Canada, access to oral health care in rural and remote regions, the importance of preventative dental hygiene care for seniors, the impacts of caps on international students on dental hygiene programs across Canada, workplace issues for dental hygienists, and trade tariffs on dental markets. As always, we, the CDHA, stated our collective commitment as a profession to advancing the oral health of Canadians. The press release also highlighted that all dental professionals, including internationally trained dentists, meet Canadian standards. During the press conference, the CEO and past president stressed that we must also address recent proposals in Ontario and Alberta that would allow internationally trained dentists who are not yet licensed in Canada to practice dental hygiene without meeting established standards. CDHA strongly opposes these proposals. They undermine the preventative care dental hygienists provide and could put patients at risk. The Canadian Dental Hygienists Association calls on federal and provincial governments to uphold professional standards and ensure to the oral health system are guided by evidence, equity, and patient safety. Do we support improving access to oral health care for rural and underserviced communities? Yes, the CDHA does. Do we support providing training and education to internationally trained dentists on healthy and respectful workplaces? Yes, the CDHA does. Do we support mechanisms to ensure internationally trained dentists are educated on the Canadian way of practicing dentistry or oral health care in this country? Yes, the CDHA does. Do we support stringent regulatory and certification processes for internationally trained dentists and dentists who graduated from a non-accredited program? Yes, the CDHA does. And do we support the current complaints and discipline process put forth by oral health professions and regulatory bodies? Yes, the CDHA does. Do we support ethical practices from all oral health professionals? Yes, the CDHA does. And do we support that all Albertans, Canadians, should receive comprehensive and quality oral health services? Yes, the CDHA does. In the same bulletin, the CDHA highlighted a conversation with the CEO and Register of the College of Dental Surgeons of Alberta. This is not a pathway for internationally trained dentists to become dental hygienists. It is a pathway to mentor the internationally trained dentist during their National Dental Examining Board process. The CEO of both organizations met. Prior to the meeting, the Supportive Pathway to NDEB Certification Pilot Program did not have a component on the healthy and respectful workplace, and this has been identified as a concern for dental hygienists. This program will now include an orientation of the healthy and respectful workplace. I understand that many are concerned that the restricted activities the ITD are permitted to provide to patients are similar to those of a dental hygienist and of a dental assistant who has completed the scaling module. I understand your disappointment, and I understand that you feel the CDHA is supporting this program. The CDHA is supporting the addition of the Healthy and Respectful Workplace module as part of the orientation. Infighting between our two associations is not helpful. This divides us and creates animosity. As I mentioned earlier, please enter your questions into the Q&A and I will respond to them. We do have serious concerns about the clinical competencies for internationally trained dentists, and we, the CDHA, have never been supportive of replacing dental hygienists with internationally trained dentists. On June 18, 2025, the Dental Hygienists Association of Alberta and the Alberta Dental Association issued a joint statement on improving access to oral health care. To address these challenges, Alberta oral health professions are focused on long-term local solutions that will improve access to care for Albertans. Alberta is a national leader in oral health care, with some of the best trained dentists, hygienists, and assistants in the country. While there are workforce and policy challenges that must be addressed, meaningful progress depends on continued collaboration, respectful dialogue, and solutions that serve both providers and patients. In Alberta, there is a process to become registered, and these are outlined by the specific regulatory bodies: the Alberta College of Dental Hygienists, the College of Dental Surgeons of Alberta, and the College of Dental Assistants of Alberta. Each regulatory body determines how an individual becomes registered. If you are in disagreement with the regulatory process, please contact the College of Dental Surgeons of Alberta. Contact your member of the Legislative Assembly. Contact your member of Parliament. Write a letter. And if you need help with advocacy, contact us at the CDHA to help you write the letter. We, the CDHA, would like to work together with the DHA and concerned members. Professionalism. On Friday evening, just prior to going to sleep, I opened my email to receive an open letter written by the DHA President, Laura Wright, and the DHA Board of Directors. And in the morning, it was published in all social media outlets. I would have preferred to have received this email privately and had the opportunity to respond. I am responding to the letter, and it will be sent to the DHA this week. I will, though, respond to the questions publicly now. Question 1. Does the CDHA support the delivery of dental hygiene care by individuals who have not completed accredited Canadian or equivalent dental hygiene training and who have not passed the same testing required of all registered dental hygienists in Canada, including the NDHCB exam? My response: each province and territory in Canada determines the regulatory requirements to practice dental hygiene by the appropriate dental hygiene regulatory body. The Federation of Dental Hygiene Regulators of Canada is a federation of organizations which have a statutory responsibility to regulate the profession. Similar organizations and processes exist for the profession of dentistry. In Canada, it is not a requirement in all jurisdictions by the provincial or territorial dental hygiene regulatory body for dental hygienists to have successfully completed the National Dental Hygiene Certification Examination. Accreditation standards are determined by the Commission of Dental Accreditation in Canada, also known as CDHA. Regulation of dental hygienists in Canada is not in the operations of the Canadian Dental Hygienists Association, nor is the regulation of dentists in Canada. Both professions have legislations, regulations, and practice standards that in the area of dental hygiene care overlap. And both regulatory bodies develop guidance to ensure client safety when these services are rendered. The CDHA ENDS policy includes end number 3, public policy environment. Decision makers have the necessary information to positively impact the dental hygiene profession and the health of all persons living in Canada. And 4, professional practice. Members are equipped with resources to promote a standard of excellence as an integral part of a healthcare team, ensuring a healthy and respectful workplace. The Canadian Dental Hygienists Association exists for its members, dental hygienists. The practice standards of other professions is not part of the mission. Our members, dental hygienists, are able to provide quality, preventative, and therapeutic oral health care as well as health promotion for all persons living in Canada. Question number 2. Was any formal consultation conducted with any provincial dental hygiene associations, regulatory bodies, or practicing dental hygienists before offering this endorsement? I believe DHA President Laura Wright and DHA Board of Directors are referring to the statement the Canadian Dental Hygienists Association supports CDCA's efforts to expand access to care. This includes promoting training and education for dentists on building respectful, collaborative workplaces that support the entire dental team, including dental hygienists. As the elected CDHA Director of Alberta and the President of the CDHA, I have participated in many lobby days with the federal government. A common concern with members of Parliament, staff, and senators is a lack of access to care. The support the CDHA has stated is in having a module added on the healthy and respectful workplace in the orientation for the supportive pathway to NDEB certification pilot program. I did reach out as a DHA member to Candice and Diana, the co-executive directors, regarding collaboration with the CDHA as a follow-up to the DHA email on the supportive pathway to NDEB certification pilot program on May 6, 2025. Neither Candice nor Diana responded. I did reach out to the Alberta College of Dental Hygienists as a registrant on April 30th, 2025, and the college never responded. As president of the Canadian Dental Hygienists Association, I have met with many members in Canada. I am aware of the concerns that dental hygienists have expressed. Neither CDHA, nor you as the DHAA, nor the ACDH can change the practice standards as set out by the CDSA. In the fall of 2023, the CDHA Healthy and Respectful Workplace survey found that 6 out of 10 respondents personally experienced or witnessed some form of mistreatment within the last 12 months. Younger dental hygienists are likely to experience more mistreatment. The impact of mistreatment resulted in 49% losing respect for the offending person, 47% of the respondents experienced symptoms of stress, 39% considered quitting their job. In meeting with the Canadian Dental Association and provincial partners and corroborated with data from the NDEB, almost 1 in 2 dentists registered in Canada over the last couple of years are internationally trained. As CDHA data from the 2023 survey shows, approximately 1 in 5 dentists are the source of mistreatment. CDHA will continue to advocate dental organizations about the importance of a healthy and respectful workplace with their members to ensure that staff value their work environments. Question number 3. How does this position align with CDHA's commitment to evidence-based, high-quality care and professional advocacy? I believe by this question, the DHAA President Laura Wright and the DHAA Board of Directors are referring to the statement the Canadian Dental Hygienists Association, CDHA, supports CDSA's efforts to expand access to care. This includes promoting training and education for dentists on building respectful, collaborative workplaces that support the entire dental team, including dental hygienists. To promote a healthy and respectful workplace, there needs to be support to those affected by mistreatment. There needs to be established or strengthened workplace policies on mistreatment in the workplace. There needs to be accountability, and finally, there needs to be more education, training, and skills development. The purpose of the support by the CDHA is to share with the members of the CDHA that the CDSA is going to include a healthy and respectful workplace module as part of the orientation of the supportive pathway to NDBB certification pilot program. The vision of a healthy and respectful workplace for dental hygienists is one that is free from harassment, bullying, and violence, physical or psychological. It is one which exemplifies strong leadership models and models respectful behavior. It is one that recognizes the professional expertise of dental hygienists and empowers them to practice to their full scope of practice. And it is one which is open, collaborative, and transparent in all interactions and decision making. It supports both the physical and psychological well-being of each member of the team. And CDHA believes that every dental hygienist is entitled to work in a healthy and respectful work environment. On October 17th in Toronto, CDHA will be hosting a leadership symposium. It is a full day of high-quality learning exclusively for dental hygiene leaders. Topics include advocacy, media relations, practical applications of artificial intelligence, and practice innovations such as genetic testing. I encourage the leaders in the province to come to this symposium to meet with other dental hygiene leaders in the country, as well as the CDHA board. It is an opportunity for important collaboration. CDHA's next national conference is taking place in Halifax in November 2026. Our national conference held in Niagara Falls had over 500 attendees with great professional development and, most importantly, connecting with dental hygienists from across the country. Opportunities to meet with the CDHA board and see as Albertans what CDHA is doing to support Alberta dental hygienists. Our second end is advocacy. Decision makers have the necessary information to positively impact the dental hygiene profession and the health of all persons living in Canada. CDHA has been actively lobbying for years to improve access to oral health care for vulnerable populations. Developing government support on issues is an ongoing organized process, meeting with targeted members of various levels of Parliament, bureaucrats, and other stakeholders to build knowledge and understanding about the issue. We are very pleased to report that the 2025 CDCP fee grids were released on April 1st and now equal the CDCCP dental fee grids for equivalent services. This has been a positive for dental hygienists in Alberta who work in independent dental hygiene practices. Our third end is professional practice. Members are equipped with the resources to promote a standard of excellence as an integral part of a healthcare team, ensuring a healthy and respectful workplace. We released a new patient resource on periodontitis and a dental hygienist resource on pronoun usage. We plan to release a clinical resource on cannabis and update our existing patient resources on vaping and cannabis soon. CDHA recently updated the customizable long-term care brochure, a valuable marketing tool for those providing oral health care in long-term care facilities. In addition to searching for employment opportunities and salary information, you'll also find our latest job market and employment survey reports. Look for our 2025 survey, which will be circulated to all members this fall, and please do fill it out. CDHA wants to ensure dental hygienists are supported in the ways they need to have a healthy and respectful workplace. This is located in the Career Center menu on the website, particularly in how to address bullying and harassment, sexual harassment in the workplace, and negotiating compensation packages. The 2023 Healthy and Respectful Workplace Survey revealed that clients were the primary source of mistreatment towards the dental hygienist. To foster a healthier work environment, the CDHA created a customizable code of conduct agreement and poster that details expected and unexpected behaviors for clients. Our final end is public recognition. The Canadian public recognize our commitment to quality and innovation, acknowledging dental hygienists as primary healthcare professionals. Promoting the value of professional dental hygiene care to the public is a cornerstone of CDHA's activities. CDHA educates Canadians on the work of dental hygienists and important links between oral and overall health. CDHA handles numerous media releases, inquiries, and interviews throughout the year, generating hundreds of articles. The CDHA strongly believes that dental hygienists should be members of both the provincial and national associations. Together we can be better, and together we are united. It has disappointed me recently that the DHA has not been supportive of the CDHA in their social media outlets. Professional liability insurance protects you against claims alleging violation of practice standards, malpractice, error, or omission, and offers a minimum limit of $2 million per claim and $5 million per year. There is no deductible. Your policy provides coverage for defense of complaints made to dental hygiene regulatory authorities, reimbursement of criminal defense costs, legal assistance, and a 2-year extended reporting period after you stop being a dental hygienist. Should you choose to move provinces during the year, the policy also moves with you. Practicing and support members have access to a free employment legal line to get advice on employment matters, including regulatory law. The contents of a contract can be negotiated, and it's always advised to have a lawyer review a contract before you sign it. Considering asking the lawyer before posting on social media if a post is appropriate. The 24/7 professional and proactive service is available to support you through a wide range of personal, family, and work-related concerns, including access to counseling services. Through the personal insurance program, you can purchase coverage individually or bundle 4 insurance products for one fee with no medical exam: long-term disability, term life insurance, accidental death and dismemberment, and extended care. CDHA is your voice, and this is your profession. I will now answer some questions in the Q&A box. Any questions not answered this evening will be compiled and answered. I'll see if I can open it. Or Sylvia, are you going to be my moderator?
Yeah, I do have them in front of me. If
okay,
you want me to outline the first one.
Yeah.
So are you not concerned that these same dentists can continue and do dental hygiene even if they don't become dentists and will not be regulated under the ACDH?
Absolutely, I'm concerned about that. So I'm going to try to see how I look. I'm going to look at my camera so I can look right at you with my eyes. I have grave concerns, and the CDHA does too. I think it is important for us to advocate as a group, and ask for more clarification. You can all look on the College of Dental Surgeons of Alberta website for the parameters that they have set into place. Should there be a clinical component? Absolutely, there should be a clinical component. And I think with advocacy and informing, your patients about your scope of practice are really important to do. Don't know if I answered that completely, but hope I did.
The next question is, if the goal isn't for an IDD dentist to become a dental hygienist, then they should be assisting the clinical dentist to receive proper mentorship, not doing a different job they've never been trained for. It's more of a comment. There's a couple of
yeah. So they're not really being trained. They're not. Yeah, I mean, when you look at the site and you see what they're proposing for the skill set that they're going to be doing, absolutely, the CDHA and myself have concerns about that, and they're not saying that it's as a pathway to become a dental hygienist. It's a pathway to become a dentist, and so perhaps I can give you some clarity. I told you earlier that I'm a professor at the University of Alberta, and so I do have a little bit more insight of the process of what happens. And so in Alberta, or in Canada, there's approximately 1,200 internationally trained dentists that are in the pathway to become a dentist. And so they have to do a NDEP knowledge assessment exam, they have to do a clinical judgment exam, and then they also have to do a clinical exam. And then once they've met those parameters, they can apply with the NDEB and work throughout that and become a dentist in a certain area of the country. They also can become an internationally trained dentist, can become an advanced placement student, and depending on where you are, some of you are not in Alberta. In Alberta, we call them advanced placement students at the university. In other provinces, they call them something else. But essentially, there's between 70 and 80 spots in Canada, and these internationally trained dentists take 2 to 3 years, and they're charged around, a significant amount of money to go to school. And then there's this new segue that Alberta has published through the College of Dental Surgeons of Alberta, which they have to do the NDEB, the first part, the knowledge assessment exam. They have to do the clinical judgment exam, and then they have to be interviewed by the committee and meet those parameters, and then have a mentoring dentist that's assigned to them. I know on social media, I mean, I did follow it quite closely this weekend. Someone had mentioned, why doesn't a dental hygienist want to supervise them? And I'll be honest, you don't want to do that. I don't want to do that. Um, our professional liability insurance, and that is why I kept that in my slideshow, is that I wanted to show that to you, how important professional liability insurance is. And as a dental hygienist, I would not want to supervise anybody that's not a dental hygienist. So I do have concerns about the lack of the clinical program in that, but I also do believe that the College of Dental Surgeons of Alberta is aware of that too, and is planning on making changes on how they're delivering that. Although that's not privy to for me to see or that we can see on the public site. Did I answer that somewhat accurately?
Yeah, and there's a lot of questions that would be very good questions to ask the actual organization that is putting forth this program. For example, the next one is, if the program is focused on areas with limited dental providers, why was the dentist I work with in Calgary, Alberta, asked to be a mentor? Those are very good questions that could be asked, to the right channel with the
Yeah, that is a good question, because if you look at the application process to become a mentor, it states that you have to have um, a demonstrated reason for having challenges finding staff and be in a remote area. If that is not happening, and it is happening in our major cities where we have lots of dental hygienists, then uproar. But I guess I challenge you, rather than uproaring on social media against each other and against the CDHA and against ultimately me as your president, channel that energy and write a very thoughtful letter, and write it to um, the CEO and registrar of the College of Dental Surgeons of Alberta. Meet with your MLA. We just had a by-election in Edmonton, very close to where I live. Reach out to your member of the Legislative Assembly and be thoughtful in the response. And let's work together to do this, because I see the anger and I see the frustration, and I know you're upset. And I know, you know, I'm sorry that the wording was confusing when you read that post. And if you'd read the message above that with Francine and Ondina, and the press release where there was so much advocacy for dental hygienists and for education, you would have seen the message was there, but the wording was it was blurry. And so the intent was just to say, hurrah, we made inroads with this regulatory body, and now they are thinking, or they're going to put in this healthy and respectful workplace which wasn't in there before. And maybe it's a baby step for us as an organization, as two organizations, as dental hygienists, that we can, encourage this conversation and be questionable. I identify myself as a primary healthcare provider. So this is unscripted. Like everything I wrote you today is what I wrote. It was my words. Now I'm on unscript. We are primary healthcare providers. In Alberta, dental hygienists have the broadest scope of practice. You can own your own dental hygiene practice. You can give local anesthesia. You can diagnose caries. You're expected to diagnose caries. You're expected to diagnose periodontal disease. You're expected to know the referral process of what to do if somebody has an atypical finding, and you are finding atypical findings and you are saving lives. If you had the fortune of coming from Manitoba or Ontario or Quebec and took the restorative module, you have the ability to do those skills in Alberta. I promote my dental hygiene students to go to Manitoba and take the course to become a restorative dental hygienist and to come back to Alberta and teach it to the rest of us that can't move away for 3 weeks or 4 weeks. We are so lucky. And I know there's many dental hygienists across the country here that have joined, that look to Alberta and are somewhat jealous of sometimes the freedoms that we have. We never had to wait 365 days to provide care because a dentist needed to come in. That happened in British Columbia. And they were able to get rid of that, which is great. But it took a lot. We are so lucky. And I know many of you that have posted on social media, you have no idea who I am. And you haven't met me personally. But I guarantee you, of a dental hygienist, I have the greatest love for this profession. I graduated in 1993. I was a CDHA member, and I was in awe of the Probe magazine, it was called at the time. And so I support you. I support you in collaboration, but I don't support negativity and I don't support rudeness. And I want to help you be a better and really support the organizations. Plural. I'm talking about be a Dental Hygienist Association of Alberta member and be a CDHA member. And let us grow together and be good together. And so, yeah, I get upset and I get worried. I see what I see in private practice. I work in clinical practice. I've seen internationally trained dentists come through my practice in different scopes as dental assistants. And I've questioned some things and I think, holy cow, okay, this makes me nervous. But if I just complain on my social media site, it's not really going to where it needs to go. We need to grow together, make an announcement together that's strong, write a letter that's strong, and support each other.
I have another
Sure. Sorry, I went
interesting
on. This
question
is how
also.
I teach too. I go on tangents. So,
Um, yes, but allowing this also allows international students to abuse the system. A lot of students claiming they are dentists but not competent to be in practice will be able to mistreat and abuse the RDA practice. How will you be able to regulate safety for the public?
well, that's a good question. And I do think that that does become some of our responsibilities. I mean, in order to become a dentist, the pathway that they have to do, they still have to do the examination process, and that's been established by the National Dental Examination Board of Canada. Um, but if we're seeing things in clinical practice, if we are working with substandard care and we are not reporting it properly, if we just decide to quit a job and move to another job, or if we just keep it internalized because we're afraid to report something, well, that becomes on us too, that we need to uh, be accountable for what we're seeing in our clinical practice. I mean, safety of the public is really, really important. And we don't want to see, we have all probably seen some experiences in our clinical lives that we're not happy with and weren't sure how to deal with them. And it comes down to solving an ethical dilemma. I'd like you to go back to your code of ethics. The CDHA has a code of ethics. Alberta, we have our own code of ethics. And in there, it gives you the policy of the flow chart of how to manage an ethical dilemma. And maybe that's what we need to go back to. We need to go back to our ethics classes from first or second year dental hygiene and reflect on that process. Did that answer that? Or
And there's another very good comment here. Why will we place internationally trained dentists in remote areas when we can place an RDH already trained in these remote areas? Let's be honest, there's not a shortage of dental hygienists. There are retention issues. If there were the proper incentives to bring and support RDH underserved to underserved areas, do you not think that Alberta and Ontario RDH would do so? The pilot project is nothing short of writing RDH equation.
yeah, I mean, I agree. Like retention of a practice is not always necessarily due to the remoteness. It can be due to other factors, and that really comes into play with a healthy and respectful workplace. We are trying to empower dental hygienists to recognize what a healthy and respectful workplace should look like. And if you are in an uh, unhealthy workplace, is calling out on it. You know, if there's reportable things that should be um, discussed with the colleges, then you do need to bring those up. As far as incentives, like have there been incentives to encourage dental hygienists to work remotely via the government? You know, that those are good suggestions. And again, I think that is where advocacy comes in. I mean, I hear you as a member and say, okay, what could we as a CDHA board do? Maybe these are things that we could bring up at our next lobby day. And then when we have the CDHA staff, I say a lobby day because we do it once a year um, as dental hygienists, but the staff do lobbying throughout the entire year, that maybe these are things that they can bring up with their teams. So I appreciate that comment, actually.
And another question here is, why isn't the CDHA supporting increasing the amount of university enrollment graduates from
Can,
dental
can you
hygiene programs?
can you
Did
say
I
that
cut
again?
off? Did I cut off? Why isn't the CDHA supporting increasing the amount of university enrollment graduates from dental hygiene programs for continuing the quality of care and quality of education for dental hygienists?
It's a good question. And so it'd be lovely if we could just say, well, we'll increase our class size from 46 to 70. But that's unfortunately not how it works. Government establishes, universities are publicly funded institutions, and the governments have to agree to increasing the funding for universities. If anything, our universities across the country are struggling with money at the moment. And so having more access to funds via tuition may help, or increasing class sizes, but that is something that institutions are looking at. Um, so it is a good question, but again, it really comes down to government support and funding those seats. So I can speak for the University of Alberta. We used to have a class of 42, and we now are a class of 46. And so we graduate 46 students per year.
And here's another question that would be best asked to the dental surgeons of Alberta, but who is providing the training and the certification for these internationally trained dentists to practice dental hygiene? Again, that would be a question
Yeah.
for
So
them.
I don't know who is in charge of the orientation. If you go on to the College of Dental Surgeons of Alberta website, under the application process, you slide down a little bit further. They say they have a full day orientation on October 3rd and 4th. And that's all that it has on it.
So here there's a question for clarification. So does the CDHA support or oppose the supportive pathway pilot for internationally trained dentists to perform hygiene duties without being licensed dental hygienists?
Well, no, that's not what the support is for. The the message that we sent out on Friday was to say that we have been successful in having them add the healthy and respectful workplace module into their orientation. So
So another question is, can you help me understand why you are taking credit for fee parity when your team was the cause of the problem, advising on video record that the hygienist should be paid 10% less, only to backpedal, please tell the truth. I can maybe, if you want, answer
yeah,
that question, was that we never advocated for a 10%. CDHA is not responsible for setting the provincial fee guides. That belongs to the provincial association, that they do their due diligence to determine what should be the fees attached to every services that a dental hygienist does independently. What CDHA does is we publish and we revise annually the list of national codes that then is sent to the provinces to attach the fee guides to it. So we never advocated for a difference of 10%. On the contrary, we were very surprised of it. We, on the other end of the spectrum, is advocating for parity for services that are performed both in a dental office and in a dental hygiene office, which we obtained.
thank you, Sylvie.
Here, there's another comment that it's disappointing that the CDHA hasn't publicly supported their hygienists and instead is concentrating on throwing the DHA on the bus. Then they are the ones that have our backs for our profession. I think you've alluded to.
Can you just, I'm throwing them under the bus? Is that what
So it is disappointing that CDHA has publicly supported their hygienists and instead is concentrating on throwing DHAA under the bus. Then they are the ones that have our backs for our profession.
Well, I guess I disagree. I think CDHA and DHA both have the backs of the dental hygienists. If you're talking about throwing under the bus, that I'm hosting this town hall that I found out on Friday night when the email went out with the letter to the CDHA addressed to me everywhere. I do have to address it here. So
there's a few questions that there's not enough information to ask them live. So if you recognize yourself, so there's one that says, very confused as there were no answers to the questions, just went off on different tangents and never addressed the concerns. I'm thinking is the 3 questions that were posed in to our president, Alexandra, were answered at the beginning of the presentation. If it's something different, please just expand in the question, the Q&A, and I'll go back to you.
Well, I thought I had answered the questions. I mean, that's the information that I presented. I'll relook at those again. The questions did come in a formal letter, and I'm working through that letter to send to the DHAA. So I'll look at what I wrote and then see if there's any other information that I can add to that.
There is another question about what legal pathways can the CDHA take to address this issue?
Well, I mean, are you talking about a legal pathway with the dental surgeons of Alberta?
I would assume with the program, yes.
With the program, I don't think we can do anything legally with regards to that. That's not our mandate as a national organization. Our national organization is to support dental hygienists. We can't. I mean, maybe I'll give you some examples of how dental hygiene has evolved in Canada, but also in Alberta. When I graduated, we did not have independent practice. We did not have the ability to take a radiograph without truly asking the dentist for permission. We didn't have the ability to do local anesthesia. We didn't have the ability to do nitrous oxide oxygen conscious sedation, and we certainly didn't have the ability to write a prescription. That's all changed in the last, I've been a hygienist for 32 years, so let's say that's changed in the last 27 years. Our scopes of practice have changed because of our regulatory body was able to advocate for that for us. This is under the purview of the the regulatory body of the dentists.
And like I
So
mentioned before, oh, sorry, I didn't want to cut
sorry,
you.
I mean, again, those complaints really need to go directly to the College of Dental Surgeons of Alberta.
And on the same vein, again, there's a lot of comments about the specific of the programs requesting, answers to this. Again, the best course of action would be to contact the Alberta College Dental Surgeons of Alberta, College of Dental Surgeons of Alberta, to inquire specifically if you are concerned about some aspect of their program. So I'm just scrolling down here. Another one, what is the motivation reason for pursuing this integration? Are we in need of more hygienists in Canada? It appears that the market is actually quite flooded right now.
Like more integration of what is the
So what
like
is the motivation or reason for pursuing this integration of
well, it's not really an integration, I'm going to say. It's just that it, it, a conversation was had about the program. We are aware that healthy and respectful workplaces are in jeopardy, and we want to improve that. And a discussion was had about it, and the CEO thought it was the CEO of the Alberta Dental Surgeons of Alberta thought we can add that to our program, and they're going to add a healthy and respectful module into their program.
And I think if I may, regarding the workforce issues, it is across the board, all oral health professions, we don't have a robust model where we know exactly where the professionals are, how many really do we have, who is full-time, part-time, clinical, in a specialty of some sort, in a large center, moderate center or remote location. And this is something that we have sat together with the Canadian Dental Assistant Association, the Canadian Dental Association, and we've put a proposal forward for funding to develop this model, to be in a position to say exactly where are those areas of challenges within Canada. So, and which type of professional do we need? Where do we need to put them? So it's to the question, are we in need of more dental hygienists in Canada? Depending where you are from, there are some locations where there's a lack of dentists, lack of dental hygienists, and a lack of dental assistants. From what we hear, what we, the type of information that we can gather, but we don't have any strong to support anything. So we are working together with all national organizations to try and put together a workforce modeling that will be very stringent so that we'd be able to really pinpoint where are the areas that we need to concentrate and what type of programs or incentives maybe that we need to lobby government to ensure that all Canadians and all Albertans and all areas of the province are well served. So that's where we are in that workforce for that question. Again, there's another comment on how this new pathway actually improves the pathway program. Many of these dentists will never complete the pathway due to financial challenges or failing grades. Will there be a final date to their supervised period? Again, another good question for College of Dental Surgeons of Alberta. There's a comment here. So why isn't the CDHA asking these questions on your behalf? They are supposed to be helping us. Do you have anything to add to that comment, Alexandra?
Could you say that again? Why is the CDHA not asking any questions?
Yeah, why isn't that CDHA asking these questions on our behalf? They are supposed to be helping us.
Yes, well, now, I mean, truly, over the last few days, we've learned more of the questions that we now know that are more of a concern. And so these are questions that we will look at as a board and and the CDHA staff will look at. So one of our mandates that we do in both the provincial and the national organizations are ownership linkage. And so we reaching out to you as members, I mean, this has been insightful to learn more about the challenges that some dental hygienists have had and are having, and what we can do to move forwards with that.
Here we have, so I appreciate the focus on a healthy and respectful workplace, but how do you see that aligning with Undina's choice not to engage directly with members on this town hall? I think she's been
Well,
answering some questions
I
directly.
guess I am the president of the Canadian Dental Hygienists Association. I am the spokesperson on here. And so I'm the one who, when I received the email on Friday night with the open letter, I thought, okay, how do I manage this? And so I spent my Saturday and Sunday developing this PowerPoint for today, and I started. I've written the letter. It's still in draft form. I mean, I only received it on Friday night after truly at 11 p.m. at night, and so this was my idea. I wanted to have a town hall with Alberta dental hygienists as soon as possible because, truthfully, I was quite overwhelmed by the comments on social media, and I thought I've got to manage this. That's my role as the president. I'm here because, many people in Alberta elected me to be your president or to be your director, and the board elected me to be the president. So, um,
And another here comment and a question. So the CDHA is supposed to be the voice of RDH, of dental hygienists. Why are dental hygienists being asked to write the letters to advocate for the profession in response to what the CDHA has endorsed?
okay, so I think we have to clarify this word of
Alexandra,
endorsement. Yeah,
I'd be happy to talk. I would speak to this
sure.
one.
Okay, yeah.
Advocacy is a multi-pronged approach. CDHA engages in advocacy at the federal, national level on a number of key issues important to the dental hygiene profession. Our provincial associations also have a strong role to play because healthcare is provincially legislated in Canada, and they advocate at the provincial level. But grassroots advocacy is one of the most effective means of advocacy. We try and engage our members at the grassroots level. When we speak to members of parliament, it's more meaningful to them when they hear from their constituents, from the people that elect them to office. That's why grassroots advocacy, provincial advocacy, and federal national advocacy working in collaboration is the most effective type of advocacy. And that's why we are asking you to collaborate in this advocacy, and we will support you in that regard. At the press conference, I did, Francine and I did state very clearly, we must also address recent proposals in Ontario and Alberta that would allow internationally trained dentists who are not yet licensed in Canada to practice dental hygiene without meeting established standards. CDHA strongly opposes these proposals, and we still do. We oppose these proposals. They undermine the preventive care dental hygienists provide and could put patients at risk. This is a publicly available information, and we call on the federal and provincial governments to uphold professional standards and ensure changes to the oral health system are guided by evidence, equity, and patient safety. Another key part of that press conference was on focus on healthy and respectful workplaces. The dentists weren't happy with the responses. We received a lot of negative comments from dentists, but it resulted in action. One of the actions is the college in Alberta has agreed to do something about healthy and respectful workplaces for dentists, because we're hearing from our members that's a retention issue, as many of you have noted in the comments. We've also heard from the dental college in Ontario. They would like our resources on healthy and respectful workplaces because of the work we did this week. So creating noise is important, and advocating at all levels. Grassroots, so individual dental hygienist is the most impactful. You might not think you have a voice, but you do, and it's very important. And government officials really appreciate it. Provincial associations and national associations working in collaboration is the best way for us to move the profession forward. Thank you.
Thank you, Adina.
I'm just cognizant of the time, so there's other comments, and we mentioned we are going to save all of them and provide a response. Do you have a last minute comment, Alexandra?
Yeah. Okay, so thank you. On behalf of the Canadian Dental Hygienists Association, it has been a pleasure to present to you this evening in this town hall. I am honored to be your president and to be a dental hygienist in Alberta for 32 years. Dental hygiene is my passion. If you have further questions, please do reach out to me and the CDHA directly at info@cdha.ca. And as Sylvie mentioned, we have collected all the questions in the Q&A, and so we'll review them, and I will just confirm my question answers that I wrote in this presentation and maybe modify them a little bit for the letter that will be sent to your president. Okay, so thank you very much, everybody, for coming.